We have just about every other country in the world as an example. And some do it very well, and some don't do it very well. But again, we have all of those examples to go from. And what they all have in common is that it's significantly cheaper to have universal health care than a for-profit driven market like we do. Now, I found also interesting that our testifier essentially described healthcare today. All the points that you made were, you described healthcare today. So for example, wait times. This idea that universal health care will make our wait time significantly larger. Well, right now, we're waiting 8 to 9 months for neuropsych evaluations. We're waiting 3 months for cardiology. We're waiting 4 to 6 months for rheumatology, neurology, psychiatry. 6 months. The cost will be paid by the taxpayers. Who do you think is paying for health care now? Not only is it all of us, the taxpayers, but we are paying significantly more than what we're getting in return. You won't be able to choose your doctor. You cannot choose your doctor today. Your plan gives you a list of people who you can choose from, and that's it. And if your plan changes mid-year, you don't get to see your doctor anymore. Rationing of care. This is one of my favorites. Universal health care relates to the rationing of care. We are rationing care today. During the peak of COVID, we were choosing who would get a vent and who wouldn't. We were choosing who would get transferred to a higher level of care and who would be left to die. We are rationing care today. And lastly, who makes that final choice about what care the patient gets? Under universal health care, it won't be the doctor. Wrong. Under today's healthcare system, it is not the doctor. Right? I can prescribe you a medication, I can recommend you get a treatment, but it is your insurance company, it is your PBM, it is your formulary who decides if you get that treatment or that medication or not. It's not me. I recommend it. And so all those things that were described is what is happening in healthcare today. And without a complete system overhaul, putting these little tiny Band-Aids on this crumbling wall is not going to do anything.